Hi, I'm Dr. Anthony Newton. I'm a psychologist and psychotherapist working for the private therapy clinic. My biggest areas of expertise, so as a psychologist, I see people for one-to-one and help with a variety of different common mental health difficulties, for example, anxiety, depression, panic attacks, but also issues in relationships with themselves, others, or the world. But also I look at patterns, really, so patterns from childhood and how that's impacting on them. As a psychotherapist, I see people either on a short-term or long-term basis. And again, it's just about trying to understand patterns in people's life, understand how they relate to themselves, how they relate to others. And how I do that really is just through talking. It's talking therapy, but I use a lot of how you present to me as part of how I understand you. So the information that's in front of me, what you bring, and also how I feel in the session is all information which we use to sort of help you achieve your goals and to think about what's going on in your life in terms of the dynamics. So when someone comes to see me for an assessment in the first session, normally I would obviously introduce myself. I would say who I am, what I do, and how I work. I normally would like to set what I would call the frame of the work, so how long each session lasts for, which is normally 50 minutes, and think about with the client roughly how long they might need, but that's more at the end of the assessment. I would normally talk about confidentiality as well, so everything that we talk about in the sessions remains confidential, really, and it's just sort of reiterating that and sort of discussing when that might have to be broken or changed. But really the first session is just for us to get to know each other, or those initial sessions. It's just for us to sort of build a bit of a therapeutic relationship, which is really important to, I guess, successful outcomes in treatment or in therapy. So it's just sort of just trying to build that therapeutic relationship. So, you know, why are we here and what do we need to do, and how best can I help you in that? So what that would involve, what that would look like is, I guess, it's taking a bit of a history, so where you are at the moment, so what are the sort of current issues. So we'll look back at sort of the past, so looking at sort of childhood, what's your childhood like, some of your early experiences. We'll look around sort of trauma with a capital T, as in big things that have happened, as well as traumas with a small t's, so the more micro things that might be missed or might not be considered as traumatic, but still have left a lasting impact on you. So we'll go through trauma. We'll look at sort of your social life, your hobbies, your interests. We'll look at support networks. So who is in your life, who's in your networks, and what do you do or don't do at the moment that's not helpful or helping. Of course, I'd always assess for risk, and I would always provide information around that. And at the end of the first session or first sessions, we would have an agreement on sort of the goals, you know, and it could be short-term, medium-term, or long-term goals. So in the next 6 weeks, for example, what can we achieve and work on in the next 6 months and the next year? So we'd have an agreement on the sort of goals, and I guess we will think together how best we can work together and collaborate to achieve that. So whether it's, you know, letting go of something, or thinking about a particular relationship, or thinking about a pattern or a relational style that you might have, for example, falling for the same person or same type of person, and thinking, you know, how you want to change that, or maybe it's about assertiveness or standing up for yourself, or it could be about just thinking about some difficult things that have happened in your life and trying to make sense of it, and how those things are impacting on you in the here and now. So I guess it's just holding all of that in mind and trying to have a bit of a plan for the remainder of the sessions. I'm a psychologist and I'm a psychotherapist, but I'm quite integrative in my approach. So all that means is I draw on different models of theory and therapy to support clients depending on what the problem is, really. So rather than me sort of impose a particular model of therapy or theory onto you, I'm more sort of bottom up in terms of I adapt how I work to the problem and to you, really, to the client. So with that in mind, I've done a lot of training in psychotherapy and psychoanalytic theory. So that's more sort of considered Freudian, but I went for a contemporary psychoanalysis really. So the contemporary bit is more around sort of relationships and relational theories, in that me as a therapist, I use myself in the work in terms of what you're bringing or what the client is bringing. I will use myself and how I'm feeling as part of the work, because it's all information. So a lot of contemporary psychotherapy I use in my work. I use myself. I do use some strategies if it's appropriate, if it's necessary. So I draw on cognitive behavioural therapy principles. So I do think about how people are thinking and also what people are doing and how that's impacting on their behaviour. And there might be some times where I will bring in some homework or bring in some tasks for people to do if it's appropriate, which could look like keeping a diary or reading something in particular about what they're bringing, or it could be about gradually exposing yourself to something that you're afraid of, or creating a bit of a hierarchy of things that you fear, for example. So it really depends on what is being brought. I've also done training in a type of therapy called dynamic interpersonal therapy, which is a form of what you could consider short-term psychotherapy, really. So it's very almost fast-paced. It's focused on one particular relationship pattern, and it's a very sort of rapid form of psychotherapy, really. So 16-session model, and by session 4, you kind of have clarity on what you're going to be working on for the remainder of the sessions. And at the end of treatment, you're given a sort of letter, an end of therapy letter, which summarises all that we've done and summarises all that you've kind of learnt and things you need to kind of work on as well. So it's a very kind of interesting model. It's very fast and it's very relational, of course. So aside from all of that, as I said, I've studied a range of different theories and models, so I have quite a good understanding of what works best for whom, and also think about sort of what the evidence base says as well. What's the most evidence-based approach for a particular disorder or issue or problem? As a psychotherapist, you have to go through your own therapeutic journey, really. So I've had my own personal therapy. I was in therapy for about 7 years or so, and I had 2 different types of therapists during that time. So one was a body psychotherapist and one was an integrative psychotherapist. And for me, it was the most valuable part of my training. It was the best learning asset for me as a practitioner and as a therapist, because it's important for me to do what I preach in a way, and it's important for me to sort of understand the patient's journey or the client's journey, actually. So how do they feel sort of coming to therapy and coming to a session? So I really learned a lot from doing that about myself, but also about how to be a therapist as well in some ways, and also find my style within that. So it's really, really important, I feel, for all therapists or anyone in a sort of helping profession to do the things which they're also telling people to do. You have to kind of be in the position yourself, and for lots of different reasons. In terms of being able to work empathetically with patients or clients. So just being able to understand what they're going through roughly, and also I guess it's good in terms of nothing will faze you, in the sense of when clients might bring very difficult or challenging material, you would have gone through your own journey to understand how you feel about certain things. So it's less impactful in a sense of maybe you don't carry as much, or maybe you can sort of process things in a slightly different way, or at least understand why you feel that way you do about what is being presented in front of you. So yeah, I really value my therapeutic journey. I'm really, really grateful for it as well. It was such a good, valuable tool, like I mentioned, and I learned a lot about myself and therapy from doing it.